There's a saying by Hippocrates, and that is, don't tell me about the disease the man has. Tell me about the man who has the disease.
I think adult day programs provide a very necessary part of the whole healthcare delivery system, in that we take care of people during the day who are still able to remain living at home but need a little bit of extra care.
Adult day services help seniors to live at home if they want to, and they help families to keep the family together.
You know, I was overwhelmed with taking care of her. In my mind, it was nursing home or at home. So when I found that there are places where you can take them for a few hours, I was greatly relieved.
When they come to the center, they have a chance to be themselves. They have a chance to be a friend. They have a chance to be a learner. They have a chance to participate in their own health. They have a chance to continue living with real quality.
Nobody wants to know that they're disabled. They want to know that they're vital and involved, and that's what we try to accomplish here.
See, what you all giving us everything, not something. Y'all putting everything into a senior citizen's life.
A great day for them is they can go out of their home to see the blue sky and also come here to have some good, fun time. So safety and happy and healthy.
My mother is 96 years old. Slight Alzheimer's is what she's got, but it gets worse. And you suddenly realize that your mother is not immortal. And there really is a shift where you become the parent. It's hard in that respect to just watch the decline. You just wish they could always be the way they were. I asked her primary caregiver if she would benefit from a daycare center of some sort, and she said she would.
In Alameda County, we have a total of 15 programs. All of the programs include transportation to and from the individual's home, hot lunch, a little bit of exercise every day that's appropriate for their level of fitness, and activities that are designed to keep them engaged both physically and mentally.
I think the dancing is such an important part. It's amazing the range of people that attracts. There was one person up there, she can do nothing else, but she can click her fingers to the rhythm.
Being around people who are experiencing some of the same things that they are is, you know, a tremendous support.
To me, they're more than just participants. They're my family. I see them as my family.
I don't know if he even knows anybody's names, but he knows that he feels comfortable here, and he knows that he knows people, and they will nod to him, and they'll, you know, worry about him if he's not here. And it's really important to him to have that feeling of belonging someplace.
Many of the family members tell me that on Saturday, their loved one gets up and wants to know where the bus is. So they must like it here because they want to come here even when we're not here.
Before this center, that we really worry, you know, because she hates this, she hates that, and pain here, pain there. But now, I'll say it's like this, she's back to normal.
She likes the staff, and she likes the people she's with. I mean, you just see her, she's smiling all the time.
She comes home and she'll tell me about different people. She would tell me about a lady who was always complaining because her knee hurt her so bad, and my mom would say, "Why don't you have your knee replaced? I had mine done, and see how good mine is now." So.
In the background of that community, they're also getting health services, they're getting practical personal care.
And so when they're here and they're having a nurse that's taking a look at them regularly and communicating with their doctors, you know, there'll be a lot less hospital visits, a lot less urgent care visits.
Instead of them being home, they're in the care of someone that understands what the needs are, and it gives me an opportunity to get away from the house.
that I could go shopping and not rush home because she was alone, that I could go for a doctor's visit. It wasn't that I went on wild trips or something. It was the small things that I could not do for many years.
Without it, we actually wouldn't be able to function any other way in our own personal lives.
We're able to claim some of that mother-daughter time again because I'm not responsible 100% of the time.
I'm not sure that her short-term memory loss is arrested, but because she's there and she's talking with other people and she's singing and she's dancing and she's doing the exercises and everything, it's made her stronger. She's frail, but she's still able to get out and work in her yard, and that's the most important thing to her. So I can't help but think that going to BACS makes her stronger and more wanting to be in the world.
The Adult Day Services Network is the association of the 9 agencies in the county, all not-for-profit, that operate adult day programs. The network brings together the providers across the county so they can work together to strengthen their own organizations and their own programs.
There's a lot of wonderful, warm, generous, sweet care that's provided for people. And there's a lot of connection that happens that really enrich people's lives and put a twinkle in their eye.
And I have a lot of fun here. I like to come, and they're good to me.
Each person who comes to an Adult Day Center is respected for who they are, they're valued, they're part of the community, and they're treated with dignity. And that in itself is healing.
I'm happy. I'm happy and I haven't been in my life, and I'm 72 years old.